And my name is Patricia Moody, and I'm the patient navigator here at the Beatrice Welter's Breast Health and Navigation Program. Why are we here today? Because we want to talk about breast health to inform and enlighten you about good breast health, which enables you to be proactive about your health, and by reminding you to do monthly self-breast exam. We want to talk about risk. We're going to talk about risk factors. We're going to talk about how to inform women about available resources for breast cancer screening, diagnostics, and treatments. Breast cancer is a disease in which malignant cancer cells form in the tissue of the breast. And the damaged cells can invade the surrounding tissues. In picture number 1, you can see that there's just one grayish cell in there. You can say that's like an early stage breast cancer, which they can go in and just remove that cell. And if any chemotherapy is done, it's very minimal. On the middle slide, you can see how it started invading a little bit. Still, it can be more or less taken out. That's probably stage 2 to possibly 3. The last one to your right is you see how it has metastasized. It's invaded more of the cells. So it may have spread to other parts of your body. We don't know. So that's why we want to stress early detection in picture number 1, because the treatment is so much better and recovery is quicker. Who is being diagnosed with breast cancer? In recent years, frequency in which a woman of color has a higher chance of getting breast cancer than anyone else. Why? It's because women of color, they don't go to the doctor as much as they should. So by the time they get to the doctor, it already started to metastasize and it already started to invade other cells in your body. Opposed to in the past, white women are diagnosed with breast cancer more than Black women. However, that has changed because Black women are being diagnosed with breast cancer more often than white people. White women go to the doctor and they get their mammograms and they get the care that they need. But we, meaning Black and brown people, we die from it quicker because we don't go to the doctor. And as you can see from the American Cancer Society, non-Hispanic white women percentage of risk developing breast cancer is 13.1, and the percentage of mortality rate is 2.2. And you can see each race broken down on mortality opposed to risk of developing breast cancer. Risk factors are anything that can increase or decrease a person's chance of getting this disease, such as cancer. 90% of women with breast cancer have no identifiable risk factors, meaning if no one in your family ever had breast cancer, that does not mean you will never have breast cancer. Doesn't mean that at all. There are many known risk factors for breast cancer, and some of these cannot change. The main risk factors for breast cancer are things you cannot change. 1, being a woman, being older, and having some certain genetic changes. Race, ethnicity, inherit genes, family history, breast density, and certain benign breast conditions. And starting your period before age 12 also is a risk factor. Also, these are risk factors: hormone therapy after menopause, alcohol intake, obesity, limited exercise, and not having children. These are risk factors that you can change. And of course, men get breast cancer also, and they are more or less screened the same way as women because men have breast tissue also. They may not have breasts, but they have breast tissue. So it's important that men know these risk factors also and know if they have any family history of cancer, because that does assist them later on in life when it comes down to breast cancer and in therapy. What can you do to lower your risk? Maintain a healthy weight, exercise, limit alcohol, and limit menopause hormone use. Years ago, there was an HRT, which is a hormone replacement therapy that a lot of women took because that will practically eliminate menopause, the hot flashes and everything. The hot flashes, not the menopause, let me be clear. So women who took this therapy years ago had developed breast cancer later on in their life. So that the hormone replacement was taken off the market. I see recently it's slowly coming back. I don't think people should take it. I don't know why it's slowly coming back, but some women who are going through menopause they really do not like the hot flashes, etc. I know I don't, but still, I'm not taking anything for it. But be careful if you choose to take HRT, a hormone replacement therapy. Okay, and of course, breastfeeding. Studies have shown that premenopausal women who breastfeed their babies are slightly less likely to get breast cancer. So you can see breastfeeding is an important factor in not getting breast cancer. However, it doesn't eliminate it. Cancer screening is looking for cancer before a person has any symptoms. This can help find cancer at an early stage. When cancer is found early, it may be easier to treat. By the time symptoms appear, the cancer may have spread. So that's why we emphasize the self-examination, having a clinical breast exam when you go to your PCP or your gynecologist. They usually give you a clinical breast exam, then get your mammogram also. If you're age 40 and above, if you have any symptoms, like if you have any dimpling of the breast where your nipple is being inverted, any other symptoms, you have a rash on your breast and you don't know where it comes from, you have a lump or something on one of the sides of your breast, those are important things to look for if you're under the age of 40. And if you see any of those things, definitely go to your gynecologist to get tested, because those are some of the symptoms or some of the visual symptoms that you will have, symptoms that you will have that looks like breast cancer. Even if you're over 40, but because screening starts at 40, a lot of young people don't think they can get breast cancer because they're so young. Again, a lot of young people get breast cancer. There's an uptake in that also, where a lot of 20 to 28-year-olds are getting breast cancer. Some of it is aggressive. Every woman should have a clinical breast exam at least 3 times a year. At age 20, again, when you start going to see your gynecologist, they should give you a clinical breast exam. Women ages 40 to 69 should get a mammogram every year. And if you're over the age of 70, continue to get your mammograms on a yearly basis as long as they are in good health. All women should know their breasts' normal look. Your breasts are like your feet. One is always larger than the other. So don't ever think that they're supposed to be the same size, because they're not. For some women, because of their family history or genetic mutations, the BRCA1 are at an increased chance for women getting breast and ovarian cancer. So that BRCA1 gene, if you get genetic testing and they see that you have that BRCA1 gene, you are at an increased chance of getting breast and or ovarian cancer. So we ask you to do a self-exam, look in the mirror, look for differences between the left and the right breast, look at the skin, see if there's any swelling. Understand, when you do this and you're on your menstrual cycle, your breasts, some people's breasts swell. So try to do this when you're not on your menstrual cycle, when your breasts are at its regular size and not swollen in any way. So look for any swelling, look under the arms for inverted, not in bumps that feels like rocks under your skin. Regarding skin changes, if you notice any unusual swelling, discoloration, or nipple discharge, these would define signs that you should seek medical attention as soon as possible. So this is just a visual of what you should look for. As you can see, one lady, she has her arms up. She's looking to see if there's any major differences. Again, they're not going to be symmetrical. However, are there any major differences? A physician will check under your arm. Under your arm is where your lymph nodes are. Your lymph nodes are more or less the highways to your body. If you had breast cancer, a cancer from your breast, and it has metastasized, it will go to one of your lymph nodes under your arm. Then it can go to other parts of your body. So that's why they always check under your arm also. Then they do the clinical exam where they try to see if they feel anything that feels like a rock. Now, everybody's breasts are like cottage cheesy feeling, and you're gonna feel that. That's normal. But if you feel anything that's different from month to month, that feels like a rock, feels like it wasn't there last month, pay attention to that and please alert your doctor that, okay, this wasn't here last month. What is it? So the doctor will check from your underarms all the way down to your breasts, to the middle of your chest, and across your chest also. Most importantly, remember that all women are at risk of getting older and have risk factors. Know your risk, get screened. If you have been screened, if you went to get your yearly mammogram, wonderful. But if you haven't, or you are afraid, or you want to have more questions, you can always call me. We can talk about it and get you screened. Here is all of my information.